Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery, and I've been in practice here in Arizona, Scottsdale, Paradise Valley for over 21 years. I just performed cosmetic surgery, and today we're going to talk about a fun topic, and that's brow lifts. What are the different kinds of brow lifts, and what is a brow lift? A brow lift is almost a misnomer because you're really not raising the brow, if you will. You're recontouring the eyebrow. So we like to see in people that have aged a much more youthful arched brow. I think the bad rap that brow lifts have gotten is because the brow lifts were done too aggressively and the medial eyebrow is too high and it gives people that scary look. A brow lift is a very elegant procedure that brings that brow into a more youthful, proportioned kind of position, but also it does other things. It makes the wrinkles between the eyebrows not work as well, and it also helps with the wrinkles of the mid-forehead. What are the different kinds of brow lifts? Well, the old kind of brow lift was called a coronal brow lift, and it's a phenomenal procedure, but it involved an incision along the top of the scalp, and that tended to scare people, and it left people somewhat numb for a while behind the scalp, so they couldn't really feel their hair back there. But it's been a very, very effective procedure for a very long time. The problem is, I think that the aesthetics were not always so great with that brow lift, and I think people ended up having an overly done brow because of that. I still do that coronal brow lift in some patients, usually some men with heavy skin, and some people that have heavy skin and very, very deep wrinkles that want a very smooth forehead. The other kind of brow lift that I do most commonly is an endoscopic brow lift. And just like in orthopedic surgery, where there are minimal incisions, for instance, like a knee operation, this brow lift involves much less of an operation in terms of incisions and has a quicker recovery. Usually there are 5 incisions, invisible ones behind the forehead, in the front and along the middle here, and then some way back in the scalp on the sides. And that allows me to shape the brow to give you that nice arched brow that's not too high in the center, and also allows me to diminish the muscles that form the wrinkles between the eyebrows. Some people don't need that work in the center, and all they need is a lateral brow lift. That's the third kind of brow lift, just where the lateral portion of the brow is elevated, and that's called a lateral endoscopic brow lift, and that's done through an incision on the side right here. And all that does is raise the eyebrow laterally, and it gives people that pretty arched brow that doesn't look too high in the center, but it does nothing to work on the muscles between the eyebrows. Occasionally I can do that lateral brow lift and perform the defunctionalization, if you will, the softening of the muscles through an upper eyelid incision. The last kind of brow lift that I do occasionally is an anterior hairline brow lift. And that's a very, very ingenious operation, especially in people that have very high hairlines. The incision for that is placed right along the anterior hairline. The incision is beveled in the direction of the hair follicles, so the incision is invisible, and it allows me to actually oftentimes lower someone's hairline to make them not look like they have such a high hairline, so there's not so much forehead, and actually can help people look more attractive, more proportion, and give much more harmony to that notion of even thirds of the face. We like to see a third of the forehead, the mid-face, and along the bottom of the face. So those are the different kind of brow lifts. I do them all, and I don't do them based upon anything other than if a patient needs them and whether it'll help them be more attractive. Thanks a lot.